Good morning, everybody. My name is Alain Astier. I'm Emeritus Professor of Clinical Pharmacy and Biotechnique, and I'm on University of Paris. And also, I am the co-president of the European Society of Oncology Pharmacy. The aim of my topic is to speak about the in-use stability of chemical anti-cancer drug and biologics, mainly monoclonal antibodies. And some words about the background of the topics. You know that for hospital pharmacy or nurses or medical doctors and for the patient, obviously, it is critical to have real data about the stability of injectable drugs in practical situations. For example, open drug formulation after reconstitution of a lyophilized product or after dilution in biovehicles such as natrium chloride or like that. Unfortunately, these data are seldom, if never, available. Why? Because the manufacturer stability data after reconstitution or dilution were quite always quoted in the summary of product characteristic SMPCs as stable for 24 hours or maybe 2 days at 4 degrees, but not for two reasons, but only by the application of the caution principle, considering possible bacterial contamination during the manipulation, or by the fact that the stability tests were only performed during a very short period of time. The problem is obviously of paramount importance for therapeutic proteins, mainly monoclonal antibodies, which is called MABs, which are very expensive. And these drugs come very, very important in the budget of the hospital, especially in oncology. Third, there is acceptable loss, even small amount, if you put on the garbage these very expensive drugs for non-scientific based reasons. Some example. What's happened in the real world, not in the clinical trials or in the SPC, but in the real world? What will happen if the entire stock of bevacizumab, which is Avastin, which is a monoclonal antibodies, in my fridge, in my hospitals, representing, saying 300,000 euros, was accidentally exposed to temperature between below 0 degrees, or if the fridge failure occurring during the weekends, what's happened? Can I keep these unusual bags of trastuzumab, for example, which is another monoclonal antibodies, for another patients? Can I send a diluted trastuzumab bag, for example, by a car or like that, during 100 kilometers in gravel road? It means there is some shock during the transportation. How long can I keep the residues of an opened ipilimumab vials, which cost approximately 14,000 euros, to use for another patient? And for example, if I consider all these questions, I can find no useful information from the manufacturers. You obtain only wooden language, response for is only 4 degrees, not more for 24 hours, do not know, follow the MPCs. Clearly is not really satisfactory response in practical daily situations. What we need as practitioners, we need to have real stability data in real situation and not in theoretical situation. These in use, the term is in use or in practice, studies are unrealized by the manufacturers or in some time unavailable. They exist, but we cannot access to this data because the manufacturer don't understand the real needs in the fields. But he said also that this is not required by the marketing authorization guidelines. And sometimes it is not very commercially interesting because as they keep along for a long time partially used vials for commercial reasons is not really useful for the industry. And the study developed more by academic studies or at the hospital levels. But if you look these stability data, ICH guidelines are not adapted for this kind of study. ICH data are developed for industrial reasons to develop the product for the stability of the product in the final vials, but not developed for the real condition of stability of the drugs. And in this field, hospital pharmacies should be highly involved. I will specifically speak about the biologic drugs, the monoclonal antibodies, because it's a very growing area of therapeutics, and they are very expensive drugs. And the problem of the immune stability data are real pregnant in this field. You know that the biologic drugs have revolutionized the treatment of a lot of pathologies, life-threatening disease, such as in cancer, such as in rheumatoid rheumatology disease, in cardiology, in pediatry, and also in dermatology. And the problem is, as you compare biologics drugs to classical chemical drugs. For example, in this slide, you have the look on the molecular aspect of the aspirin, which is the small molecules, as compared to the interferon beta, which the molecular weight is 100 times fold. But you say that the structure is very complex as compared to the classical drugs. And if you consider monoclonal antibody, the size, the molecular weight of the monoclonal antibodies are tenfold the molecular size of the interferon beta. You understand that the problem of the stability of the structures are not the same as compared to aspirin, with the instability, the degradation of aspirin is very simple. There is only an hydrolysis which transforms aspirin to salicylic acid, but it's only one way, it's very simple. But the degradation processes of this kind of molecules, obviously, are very, very complex. And if you speak about instability of drug or stability of drug, which is the same, you have to speak about the cause. What caused the instability of drugs in general, and especially for biologics? In the vast majority of times, it's a temperature change, for example, elevation of temperatures, but also freezing. It's specific for biologics. For example, if you froze aspirins or if you froze this kind of very simple drugs, nothing happens. But if you froze proteins or monoclonal antibody, we can observe degradation or not, depend of the molecules. Also, another cause of instability for biologic are the change in formulation by dilution, because the product in the final vial, is stable because the pH is adjusted or like that. But if you dilute, for example, by natrium chloride or glucose or like that, you change the composition of the solution. For example, you can change the pH by dilution. And in this case, there is some risk of degradation due to the change of the pH. You can also observe absorption on the surface, which is very characteristic from protein. You can absorb on the walls of the vials, of the bags, the plastic bag, the tubulus, or like that. Also, you have another cause of instability, which is the oxidation. Oxidation means the presence of oxygen, it's okay, but also metal ions, such as ions or coppers. And we can introduce by dilution or by manipulation with the needles or like that, you can introduce inside the vials some trace of methyl, which can be enough to catalyze oxidation. And also another cause of instability for biologic are checking or sharings, because it means the exposure of the solution of the product to hydrophobic interface. For example, if you check the bags to homogenize the content, you can cause degradation. It's not happening if if you dilute, for example, an antibiotic, or if you dilute corticosteroid like that, which is very stable and not sensible to shaking, and also the change in concentration. And for protein instability, very quickly, there is two general cause of instability. The classical is the chemical instability, which is classical, but as compared to small molecules, we have not only one possible degradation pathway, but a lot of possible degradation pathway, which can occur simultaneously or consecutively. And for example, desamidation, which is the hydrolysis of amino acids to loss ammoniac and to liberate aspartic acids, and also oxidation, hydrolysis, isomerization, declosination. It means that there is a lot of possible pathways of degradation for biologics, which can induce a very complex way of degradation in general. Another cause, is the physical instability. It's a characteristic of protein. It's not happen in general with small molecules such as aspirins or like that, but for biggest molecule such as monoclonal antibodies, such as proteins, this physical instability can occur and can be a very, very important way of degradation. There is three big kind of degradation by physical instability for proteins. The first is aggregations. It means that the small molecules aggregate together to form bigger particles. Denaturation, it means that the protein, the higher structure of the protein, the tertiary structure of the protein, or the secondary structure of the protein can be disturbed and can be modified. It means that denaturation. And also, as previously described, the adsorption on the surface. For example, if the protein is in low concentration in the bag, for example, insulin, because 100 units of insulin represent a very small amount, some micrograms of proteins, it's enough to be adsorbed even totally on the surface of the vials. And the consequence is there is nothing in the liquids, in the bottle, but all is sticked on the wall of the vials. And there is a picture of some aggregation in a bag. You can see in the circles, you can see small particles, but not so small because you can see at naked eyes. And there is a characteristic of visible aggregation. It means that the aggregation can be seen by the naked eyes, but sometimes, and more harmful, we can have non-visible aggregation. And this aggregation of protein is very important because it's the principal physical instability of the drug, mainly for monoclonal antibodies. It's a non-classical degradation. There is no change in general of the chemical structure of the proteins, but it's only the change in terms of physical structures. And you have to keep in your mind that this aggregation, fortunately, is a general response to protein to any stress. If you shake a protein, if you eat a protein, if you freeze a protein, like that, if you expose protein to ultrasound or to gamma X-ray or as you want, the first response you can see is not only the one, but we can see in the first time you can see aggregation. It means that if you look for aggregation, it's a very good marker of stability or instability in response to any stress. As previously explained, you can have complex behaviors. You can observe soluble or insoluble aggregate. It means there is a small size aggregate. It means less than 1 microns or maybe 200 or 300 nanometers. And insoluble aggregates we can see, and the size can be 10, 20, 33, 100 micron. And the origin of aggregation are very, very various, But underestimated cause of aggregation are mechanical stress. It means shaking or steering. It means sharing is a force induced by, for example, if you have a rapid sampling by syringe of the mixture, you induce a lot of force. We can degrade the proteins. And also is the exposure to hydrophobic gas interface. It means the bubbles. For example, if you shake a protein solution with an edge space with air on the top of the liquids, you induce a lot of foam. We can induce hydrophobic interface, and the proteins are very sensitive to these interface and can degrade and can form aggregates. What is the importance of this aggregation? Sometimes nothing happens. You have aggregation, but you can only eliminate the aggregate by filtration or line filtration. It's enough. There is no harmful for the patient. But sometimes, and it can be very different from protein to protein, even the same class of protein, for example, from one monoclonal antibodies to another monoclonal antibodies, the importance of aggregation can be different. There is two major implications. The first are the inducing of toxicities, mainly immunogenicity, because the degraded protein of the aggregates can induce immediate immunogenic response, such as anaphylactic shock, which can be very harmful for the patients. And the second consequence are, but for more long-term consequence, are the loss of efficacy. It means that after the second, the third, the fourth administration of a monoclonal antibody, for example, infliximab for rheumatoid disease, for example, or Avastin for colonic cancers, we can see the appearance in the blood of the patient of neutralizing antibodies again the monoclonal antibodies. It means that for the same dose you administer, the final dose, which can be act for its pharmacological action, will decrease, and there is a final loss of efficacy for the patients. The problem is we can furnish to the wards, the medical wards, we can furnish this kind of bags. It's an example of 700 milligrams of rituximab, which is the very important monoclonal antibody used in some hematologic diseases. And the problem is what happened during the handling of biologics. And the problem is there is heterogeneous practice, because if you use a product at home, it means that it's a patient itself, or maybe the nurse, which will manipulate the final bag. You can check or not check. You can keep it in the fridge. The fridge of the patient can be of good quality or bad quality or like that. In the wards, it's the same, depending of the people manipulating, handling the vials. For example, the qualification of the people, the experience of the people, like that. Does the product is manufactured by centralized pharmacy units, which is the main case in most European countries, and it means the centralization, the preparation of the final bags to be administered to the patient. It's performed by the pharmacy, and it's a more centralized system with people with good experience to manipulate the drugs. The job of the pharmacy is to prepare the drugs, and in good workers and environment protection, because this product can be harmful for the manipulators, and you have to manipulate under specific condition of security, laminar flow or like that. And you can in this case, you can obtain the best quality for the final product. It means that it's a good concentration, it's a good virus in the good vehicle or like that. And it means that the efficiency of the final product to be administered to the patient will be the best as possible. And you have to, for the biologics, the anti-cancer drugs mainly are in European country. I don't know for Ukraine, but in most of European country, the handling, the preparation of the biologics in their final formulation are performed by the pharmacist in the centralized unit. Okay, and what can happen during this practical situation, in use practical situation? There is a lot of possibilities of mishandling of the of this kind of product. For example, temperature exclusion. It means that there is a change of temperature, breaking of cold chain. There is bad storage in the water. The bags it's kept on the table of the nurse for a long time. For example, there is an increase of the storage period for a long time in the water in bad condition. The product is not administered, or the administration delayed, because, for example, in the hospital, the patient is not here, and if the bag is prepared for the patient and the patient is not here, it means that we cannot administer the bag because the patient is not available. May I use viral residues? If you consider the very high cost of this kind of product, is not so bad to use all the product as possible, but depending of the posology for the patient, maybe you can use only half of the vials for a patient, and may I keep the residues for another patient, for example. The preparation of those banding, checking bulbing, may I check or not? May I use, metal needle or not? Remember that metal needle can induce oxidation by catalysis. May I use the same or several kind of plastic bag? Because PVC is not polyolefin, it can be different in terms of, for example, absorption or release of plastifiant. And also what's happened in terms of transportation. For example, the bags from the pharmacy to the wards is depending of the size of the hospital, is depending or like that. Long distance, if I prepare bags in the hospital A to be transported to the hospital B, for example, 200 kilometer distance or like that, what's happened during this kind of mechanical stress during the transportation or like that, okay? And, it's in this case, we need to have practical stability studies. And these practical stability studies, there is no real guidelines until 2011, where a group of hospital pharmacy from several countries of Europe have defined a consensus about guidelines for practical stability study to be published in the scientific journals. And I will finish by one example. In my lab, we for 20 years we studied the stability of proteins, especially monoclonal antibodies. And at the moment, we have a lot of data and publication about the stability of a lot of classical monoclonal antibodies, such as cetuximab, trastuzumab, and also biosimilars of this drug, bevacizumab, ipilimumab, infliximab, the principles of some biosimilars, elasparaginase or nivolumab. And we have submitted these molecules to thermal or mechanical stress to mimic which can happen during the practical manipulation in the real world. There is a lot of publication about that you can find on the net. And I explained previously that the stability of monoclonal antibody of protein are complex. It means that to determine the stability of this drug, we need to have a lot of analytical methods. One method is not enough, and you need to have several orthogonal methods, complementary methods, to determine all the aspects for the degradation of the drugs. It means the degradation of the primary structure, the secondary or the tertiary structure. You have to determine what's happened in terms of aggregation, by, for example, by turbidimetry and ephemery, or dynamic light scattering for subvisible aggregation. Also, the modification by chromatography, ionic chromatography, size exclusion chromatography, like that. Thermal denaturation curve will give some data about the global thermodynamic stabilities, and also to determine the pharmacological activity to see if in some condition of storage, for example, for long time storage, for example, at room temperature, see if the drugs remain unaltered or keep is the full pharmacological activity. I take an example, is the stability of diluted rituximab. The problem was in my hospital to develop dose bonding. Dose bonding means you prepare only one of two concentration, and can be fit all for the patient. And it permits batch preparation with good quality in terms of GMP, and it's in optimization for pharmacy and nurse workloads. You improve the quality for the patient, the waiting time can be reduced, or like that. And very importantly, you save a lot of money because there is no waste for vials, because you have standardized dose, if you want. And for that, we need, it was 10 years ago, we need to have extended stability data. In the data from the manufacturer, nothing. Okay, only it's stable for 24 hours at 4 degrees. It was obviously not satisfactory for our purpose, and we perform a global, a full stability studies published in the Journal of Pharmaceutics about the molecular antibody rituximab, the principle from Roche. Okay, and some example very quickly. We have shown that by peptide map, which is a method to see if there is alteration or not of the primary structure, you can see that absolutely is the same. A is the solution freshly prepared, and B is after 3 months. 3 months. 3 months at 4 degrees. You can see that exactly the same profile, showing that there is absolutely no modification of the primary structure. For the secondary structures, we can use a lot of methods. The best used is the Fourier transform infrared spectrometry, and you can see this is an example. The red curve and the black curve. The red is after a long time storage, and the black is just freshly. You can see there is very comparable. The wavelength are very similar. But if you look in this case of the product is degrade in stress condition, you can see that the profile is totally different with the change, the shift of the some bands. We can induce, you can show that the product has been modified in terms of secondary structures. The same, we can calculate all the percentage of the different form of the beta structures, alpha helix, or like that, which are the characteristics of the secondary structure for proteins. The same thing for the tertiary structure, which is the final global structure of the proteins, and it's the same method by UV or like that. And in this case, you can see in this example, after 1 month, 30 days, there is the blue curve, there is no change, no significant change in the profile of the spectra, showing that the product is stable for the tertiary structure, even after 1 month at 25, in this case, is room temperature. And the size exclusion chromatography is the method we can permit to see if you have very small aggregates, for example, dimers. You remember that a protein exists in monomer forms or in dimers or tetramer forms, and dimers is the first aggregates we can appear, and we can see, for example, for the rituximab, there is only one peak. There is no peak before or after, showing that there is no modification, same thing, after, freshly prepared after 1 month. But in this example, which is another product, you can see here there is some additional peak, show characteristic of agglutination, aggregation, but small extent for dimerization of the infliximab in specific condition. Same thing for ionic variant. which is a method which can permit to see if there will modification, for example, in the glycosylation of the monoclonal antibodies, is the modification in the amine termini of the protein or like that. This method can be used very classically to determine if there is some modification in the protein. And it's same example, G0, freshly prepared, and rituximab after 28 days, it means 1 month, you show that there is the chromatogram at exactly superimposable, showing no modification, no additional peak, no degradation of the peaks or like that. It shows that nothing happens in this term of protein. Same thing for the size analysis. This is the method to see if there is a submicronic, it means the size of 100 nanometer or like that. In this example, there is only one peak which corresponds to the size of the monomers of rituximab. But in this example, which is the stress, strongly stressed, you can see at 100 nanometer, the appearance of the new population. It means that the appearance of aggregates, it cannot be seen but by naked eyes, because 100 nanometer is very, very small. But by this method, we can see this kind of aggregation. We sign that something begin to happen in terms of aggregation. And to finish, you can determine the pharmacological activities. And in this example is you know that rituximab induced the death of the cells expressing the CD20. And if you use cell expressing CD20, you can determine the curve of the cytotoxicity by rituximab. We increase the amount of rituximab, and you see the percentage of inhibition of growth. It means the killing of the cells. And you can see here that even after more than 6 months, you can see that nothing happened, and the pharmacological activity of rituximab, even if you keep after dilution for more than 6 months, not 1 day, but 6 months, there is absolutely no difference in terms of efficacy. It means that, conclusion, these molecules, at the opposite of the claim of the manufacturer, is stable up to 6 months in polyolefin bags. It means after dilution, stored at 4 degrees in the fridge, but also at room temperature. And we had the answer to our question. It was possible to prepare in advance, to make those binding, to make in advance by batch and like that, because we have demonstrated that the product after dilution, prepared under sterile condition, obviously, can be safely kept without any change. And it's very interesting because, for example, in my hospital, we have saved 150,000 euros only by keeping for a long time and to prepare in advance the rituximab. Okay, and to conclude, we have published recently papers about the physical stability of monoclonal antibodies, which is a review of all the problem, the techniques, and like that. It's recently published in Journal of Pharmaceutical Science, and we have performed a lot of studies on another monoclonal antibodies, and very classically, all these monoclonal antibodies can be more stable than indicated by the SMPC. It means that you can keep, in general, for more than 1 month at 4 degrees after dilution. This drug can be kept safely without any problem. In conclusion of my talk, I would say that in-use analysis of protein or chemical anti-cancer drugs or other drugs, the same, require several methods, complementary, and especially for proteins, which are very complex molecules. And remember that the degradation pathway can be more complicated, requiring a lot of several methods. Remember also that for the proteins, instabilities are both physical and chemical, not only chemical for the another drugs. The aggregation is the initial response for any stress, and for that aggregation must be fully evaluated. It's very, very important part of the in-use stability study of the proteins. And we can find in the literature some papers which poor evaluation of aggregation. It's a bad way, and it's required, it's absolutely mandatory to have a very good evaluation of the aggregation, because remember, aggregation can be very harmful for the patients. And we can also perform in vitro biological activities, but it's a complementary method. It's not only the method to be used if you want to demonstrate that a biologic is stable or not. Thank you for your attention.